Can birth control affect weight? If you're considering birth control and worrying about whether it might affect your weight, you're not alone. Many people have this concern, and it's important to understand the facts. Let's start with the general idea that birth control comes in many forms, each with its own way of working and potential side effects. Most birth control methods do not directly cause weight gain, but there are some exceptions and factors to consider. One of the most common types of birth control is the combined hormonal pill, patch, and ring. Research shows that these methods generally do not cause weight gain. For example, studies have found that people using the pill, patch, or ring typically do not gain more weight than those not using any birth control. On average, users of these methods might gain about 0.4 to 0.88 kilograms, 0.88 to 1.94 pounds, over a year, which is not significantly different from those not using hormonal birth control. However, there are a couple of birth control methods that might be associated with weight gain. The Depo Provera shot, which is given every 3 months, is one of them. This shot contains a high dose of progesterone, which can increase appetite. On average, people using Depo Provera might gain about 2.3 to 4.9 kilograms, 5 to 10.8 pounds in the first year. But remember, this is just an average, and some people might not gain any weight at all. Another method that might contribute to weight gain is the implant, though the evidence is less clear. Some studies suggest that users of the implant might gain a small amount of weight, but it's not consistent across all studies. For instance, one study found that implant users gained about 0.1 kilograms, 0.22 pounds, over a year, which is similar to those using the copper IUD. However, more research is needed to confirm whether the implant actually causes weight gain. Fluid retention is another factor to consider. High levels of estrogen in some birth control methods can cause fluid retention, but modern birth control pills and other methods often have low estrogen levels to minimize this effect. Any weight gain from fluid retention is usually temporary and levels out within the first few months of starting the birth control. It's also important to think about other factors that could influence weight gain, such as lifestyle changes, stress, and diet. For example, if you start taking birth control during a time when you're also becoming more responsible for your own food choices or experiencing high levels of stress, these factors could contribute more to weight gain than the birth control itself. To reduce the risk of weight gain, it's a good idea to maintain a healthy lifestyle. This includes developing an exercise routine, stabilizing your eating habits with healthy food choices, and managing your stress levels. Getting enough sleep and practicing mindfulness can also help. In summary, while most birth control methods do not cause significant weight gain, there are exceptions like the Depo Provera shot. It's essential to discuss your individual health needs and concerns with your healthcare provider to choose the best birth control method for you. By understanding the potential side effects and maintaining a healthy lifestyle, you can make informed decisions about your reproductive health.